Welcome to the Providence St. Mary Neuroscience video presentation of spine class. This presentation is intended for patients that are scheduled for spinal surgeries and the family members and caregivers that may be helping patients prepare for surgery and that will be providing care for them after surgery. This presentation will help prepare you for what to expect before surgery and what to expect from the time you check in for surgery until you discharge from the hospital. It will explain your care team and what you can do to prepare for surgery and your best possible recovery. We will also discuss where to find help and information and discuss some frequently asked questions and concerns from previous patients. If you have questions that are not answered in this presentation or would like to discuss anything further, please contact a nurse in the neurosurgery clinic at your convenience. You may call during clinic hours or you may send a MyChart message. The neurosurgery team includes our surgeons, the physician assistants, the registered nurses, the medical assistants, the patient services representatives that work at the front desk and answer your calls, and the authorization team. At your preoperative appointment in the neurosurgery clinic, you will receive a booklet that was developed by our surgeons. This booklet is very important to read and will answer many questions you may have as you prepare for surgery and during your recovery. During your appointment, depending on when you were last seen, a physician assistant or your surgeon may need to update your physical exam. They will discuss your surgery and answer any questions about the procedure. A nurse will review your preoperative instructions and your medication list and discuss any medications that you need to stop before and any medications that will need to be held after surgery and for how long. It is important that we know what prescription and over-the-counter medications you take, as well as any vitamins and herbal supplements you use. You will sign your informed consent and pain care agreement forms and designate someone that will provide transportation for you when you are discharged from the hospital. You may not drive yourself or use public transportation to leave the hospital, so it is necessary to have this plan in place before we may proceed with your surgery. Another appointment that is scheduled within the month before surgery, usually on the same day as your preoperative appointment, is the pre-admission exam in the outpatient procedure center. This is an appointment to complete any preoperative testing that is ordered, which may differ depending on your health and the procedure that is scheduled. These tests often include a chest x-ray, ECG, blood tests, and a MRSA culture. This culture is obtained by swabbing the back of your nasal passage, and the results show if you've had exposure to a resistant bacteria that may affect what antibiotic you receive for your surgery. In addition to this video, we hold a live, small group spine class. During this class, the neurosurgery nurses and the St. Mary Therapy Department present information included in this presentation, answer questions, and the therapists offer demonstrations for working with your postoperative restrictions and precautions for activities of daily living as you recover from surgery. You are welcome to join us and bring your family members or caregivers. Please call the neurosurgery clinic for dates and times that you are available to attend. 2 business days prior to your scheduled procedure, a medical assistant will call to notify you of the time you will need to check in at the outpatient procedure center on the day of your surgery. They will also review your preoperative instructions during this call. On the night before your surgery, after a bath or shower, you will towel dry and follow the instructions on page 15 of your Preparing for Surgery booklet for use of your pre-surgical wipes that are provided to you at your preoperative appointment. You will use one wipe for each zone of your body, and it will be helpful to have someone help you reach some of these areas. If you don't have anyone available to help, wipe the areas you can reach, and this process will be repeated after you check in for surgery at the hospital. Allow the solution to air dry on your skin. Once you have used the pre-surgical wipes, do not put any product on your skin. This includes deodorant, lotion, powder, fragrance, hairspray, makeup, nail polish remover, or anything you would normally put on your skin. Put on clean pajamas and sleep in freshly washed bedding. Do not eat or drink anything after midnight. On the day of your surgery, do not shower or put any product on your skin. Do not eat or drink anything, and this includes coffee. Essential medications may be taken with a small sip of water. Review page 17 in the Preparing for Surgery booklet for specific advice on what to bring and what not to bring with you to the hospital. Generally, do not wear jewelry or bring large amounts of money or valuables. Any items you choose to bring with you or may need after surgery should be labeled. If they have cases, bring them in cases and make sure the cases are labeled. Be sure to bring your brace that was provided at your preoperative exam and any assistive devices such as a walker that have been recommended for use after surgery. You should also bring a set of comfortable, loose-fitting clothes and supportive walking shoes. Any personal hygiene items that you prefer to what will be provided at the hospital, an updated list of your medications, vitamins, and supplements, a copy of your insurance card, CPAP or BiPAP machine if you use one, a copy of your advance directive, and your Preparing for Surgery booklet. Information on advanced care planning and a link to an advance directive form are available on the Providence website, or you may follow this link listed on the screen here. To discuss advanced care planning with a trained facilitator, you may contact St. Mary's Chaplaincy Services at 509-897-2942. When you arrive at the Outpatient Procedure Center at your check-in time, you will complete any paperwork that may be needed. Once you have checked in, a nurse will escort you to the surgical prep area, where you will repeat the pre-surgical wipes and put on a surgical cap and gown. An IV will be placed and IV fluids and antibiotics will be administered. You will then meet with your surgeon and the anesthesiologist to answer questions and discuss any changes since your last exam. Anyone accompanying you will be able to wait in the Outpatient Procedure Center waiting area where they will be updated on your progress. After your surgery, you will wake up in the recovery room where you will stay until you are stable to transfer. For outpatient procedures, once you are safely stable, you will discharge from the Outpatient Procedure Center. Most patients will transfer from the recovery room to the surgical floor of the hospital. This usually occurs about 1 to 2 hours after surgery. Some patients may require a short stay in ICU before transferring to the surgical floor. When you wake up after surgery, you will be wearing your brace and a couple of other accessories. A Jackson Pratt drain, or JP drain, may be placed to draw excess fluid from your surgical wound into a clear bulb that will be attached to your gown. This speeds healing and decreases the risk of developing a post-op infection. The drainage in the bulb will be managed by the nurses, and the drain will be removed before you discharge from the hospital. The person that will be helping you care for your incisions after surgery may want to look at the drainage in the bulb so they know what normal drainage looks like. You will also wake up with sequential compression devices, or SCDs, around your lower legs. These are connected to a pump at the end of the bed and alternately inflate and deflate to move the blood in your legs while you're not mobile to decrease the risk of developing blood clots. You will need to call your nurse to disconnect these before you get up and walk. The inpatient care team will plan for your safe and appropriate discharge. Any concerns or questions should be discussed with your case manager, nurse, physician assistant, or surgeon while you are in the hospital. The care team will work on transitioning you from IV medications to an oral regimen that will adequately manage your pain to a tolerable level at home. They will make sure your bowels are functioning, your lungs are recovering, and you have the care and support you will need after you leave the hospital. Slow return of bowel function after surgery is frequently what delays readiness to discharge from the hospital. Chewing gum may speed the return of bowel function. You may bring your favorite flavor and chew gum for 10 minutes every 2 hours to help your bowels wake up after surgery. Patients may be discharged home, or they may require a short stay in inpatient rehab or an outpatient rehabilitation facility. On the day you are discharging from the hospital, you will need your driver to pick you up by 11 o'clock in the morning. Grade-specific postoperative precautions and bracing instructions are detailed in your Preparing for Surgery booklet, starting on page 23 for neck surgeries and on page 24 for back surgeries. Grade of precautions is determined during surgery based on the quality of your bones and the procedure that is performed. After surgery, your brace provides support for your spine as it heals and becomes more stable. Your precautions are to protect your healing spine from injury. It is critical to ensure the best outcome from your surgery that you strictly follow the instructions, restrictions, and precautions until you are cleared to advance your activities and wean the use of your brace. In order to follow your precautions, it is expected that you will require assistance with care at home after surgery for showering, wound care, transportation, shopping, meal preparation, household chores, and activities of daily living for 1 to 3 months. When you are cleared to start weaning the use of your brace and advancing your activities, this should be done slowly and as tolerated. If the activities increase your pain, you will need to back off and go slower. The following video was prepared by St. Mary's Rehabilitation Therapy Services to provide additional information on your bracing and precautions, and to offer demonstrations for how to change positions without bending and twisting your spine that you may want to practice before surgery. The physical and occupational therapists will work with you after your surgery so you are comfortable with these precautions before you go home from the hospital.
Hi, my name is Darlene, and I'm here to talk to you about the things you need to do to prepare for your upcoming surgery. And I want to talk about setting up your home first prior to surgery. It'd be good if you guys go through and look at everything you're reaching for over your head or bending over to pick up. You're going to have some limitations with bending and reaching after surgery, so move everything before so that you don't have to worry about it after surgery. Put everything within waist-high level to make it easier. The other thing to consider is adaptive equipment you're going to need for showering and bathing. You don't have to go out and buy anything, but try to source where you might get it. And we can help you with checking out secondhand stores, loaner closets, some of your church organization, friends you can borrow it from. But if you're going to need a shower chair or a handheld shower, you might want to know where you can get your hands on those before you come in to have surgery. That way you don't have to worry about it afterwards. The other thing is if you're going to be using an assistive device for walking, like a walker or a cane, you might want to pick up your throw rugs until you're moving a little bit better after surgery. You don't want your walker or your cane to get hooked on an edge and cause you to fall. So clear your walking surface so that there's no issues. And the other thing to talk about is food setup. So if you do your own cooking and you don't have someone who's going to prepare your meals, you might want to go ahead and cook a few meals, 5 to 7 days in advance. Easy things to get out of the freezer or just easy things to prepare. You're going to be hurting and things are going to be going slow, and you don't want to spend a lot of time in the kitchen. And so hopefully you'll have someone who can help, but if not, plan ahead and prepare. So I would like to talk about the A, B, and C braces and what it means for cervical braces. The brace is the same whether you're an A, B, or C. An A brace means no brace. You'll get one because it's for comfort. But you won't have any other restrictions. You can move your head gently, and you can move up and down, and move slow, don't move sharply. And if it doesn't hurt, it's okay to move. You do have a 5-pound weight limit for lifting, and you would still have a 45-minute sitting limit. So every 45 minutes, set an alarm, a timer, something, but get up, move around, kind of shake your body off, and then you can sit and rest and go back to doing what you were doing, whether it's computer work or TV or reading. But you do need to get up every 45 minutes. And for the B brace, you will have the brace. It'll be off when you're in bed. It'll be on when you're up and moving. With any movement, you should be wearing the brace. You can undo it, loosen it, or take it off for eating. So that you can eat easier. But when you're up and moving, it goes back on before you get to your feet. And you should also sit to shower. And it's the last thing that comes off before you start your shower. And it's the first thing that goes on when your shower is done. So in addition to the 45-minute sitting limit and the 5-pound weight limit for a B brace, they also want you to very much limit exaggerated movement in your head. You can do gentle, slow back and forth and up and down, but they don't want any big turns in your neck. So the brace is just to kind of help you to be aware that small movements are okay, but big movements aren't. So you can loosen it when you're sitting, you can take it off for eating, and you can take it off when you're sleeping, but when you're up and moving, it needs to be on. So the last one is the C brace, and the C brace is worn 24/7. It even stays on for showering. We do encourage you to sit for showering. You shouldn't be standing when you're showering with a C brace, and your pads will get wet, and we will show you how to change those pads and to properly get everything back so you can have a dry brace after you're showering. You should change those pads from a laying down position, and hopefully you will have someone who can help you change those pads out. But someone can do it themselves. We can show you how to do it, and you just need to let us know if you're going to be doing it or if someone's going to be helping you, because we will work on that after surgery as well. So after your surgery and you come up to the floor and nursing gets you settled in, therapies are going to come in to start working with you, and we're going to get you sitting to the edge of the bed and get you moving, and work on helping you learn how to do the log roll in and out of bed if it's required, and helping you adjust to your brace so that you can manage it yourself, and also working on toileting and being able to manage your transfers on and off a toilet, in and out of bed, safely up and down from a chair, and if needed, even getting in and out of a tub if you have a tub at home. And therapies will work with you on that after surgery. The next thing to know is that physical therapy, when they come in to see you, they're going to work on stairs. They're going to talk to you about car transfers. And they're also going to work with you on helping you to walk safely so that you can get up and walk as much as possible. They'll help you to be fitted for a walker if you need it. If you have a walker at home, bring it in with you. And they'll make sure everything on it is fit for your height, and they'll use your own if you have it. That will make sure you, if you need one when you're discharged, we'll make sure that one is brought in for you. The last thing that we'll talk about for occupational therapy is they're going to help you to work on lower body dressing. We want to make sure that you can safely reach your feet and stay within your precautions. And so you might need a reacher. And this is used to help you get clothing over your feet, and we will show you how to use these. And this is a sock aid, and so you actually put the sock over the sock aid and you drop it down to the floor, and you use these little ropes to pull it towards you so that you can get your foot through and then pull the sock off. And we'll go over these. I just want you to know about the sock aid and the reacher, possibly a long-handled shoehorn if you need it for shoes. If you can reach your feet without bending, you're not going to need this material. If you can't reach your feet without bending, you're going to need to have someone help you, or you're going to need to think about getting some of this equipment so you can get dressed safely. Now, if you can bring your feet up, there's no reason why you can't rest your leg on the bed and reach your feet without bending or twisting. Physical therapy, when they come in to see you, they're going to work with you on also getting in and out of bed safely, walking, fitting you with a walker if you need it, and they'll work with you on steps. You may not have steps in your home, but there are steps in the community. So we do like to have everyone do stairs before they go, just to make sure there's no issues or concerns. And if you're concerned about getting in and out of your car, physical therapy will also work with you on techniques and show you and demonstrate how to safely and comfortably do car transfers. And all of that will be addressed before you're discharged as well. The last thing I'd like to go over is just some mobility. I'm going to demonstrate a log roll, getting in and out of bed, and I'd also like to demonstrate a technique for safely getting in and out of a chair. If you have a bending limit and you can't bend, you really need to be able to keep your trunk tall for these items. And so I'm going to come around and show you how to do that. So now that you're comfortable and laying down, someone's going to want you to get up again. So the first thing you do is you're going to bend your knees. You're going to reach your arm across your body. You're going to keep both your hands in front of you, and you are going to take your body and roll your whole body as one and get onto your hip. Take a nice deep breath. Then as you get ready to sit up, you're going to push your hand into the bed to help you to come up, and you're going to kick your legs out at the same time. Walk your hands up so that you can be in a seated position. And that is the log roll. So the last thing I'd like to talk about is getting in and out of a chair using good body mechanics and trying to keep that back straight and tall. With bending restrictions, you won't be able just to bend down and sit. That's a no-no. So we want to make sure that you back up to the chair and you can get your feet a little hip width apart. If you're more comfortable bringing a foot forward, you can do so. It's whatever gives you the position of strength in your legs, because you're going to have to use your legs more than anything else to help you to sit. But you're going to put your hands back already so that when you do start to sit, keeping your back straight, you can reach for the chair and you'll know when it's there, and then you can sit and get comfortable. And for getting out of a chair, you're going to scoot forward. You're going to get your feet again in front of you. You can put them apart a little bit, or you can keep them together, whatever works the best. And then you're going to use those legs and power up and use those hands for balance, and then you're going to come forward.
Frequent walking is your #1 task after surgery and the only therapy that is recommended for most patients. Set a timer and walk at least 1 to 2 minutes every 45 minutes during your normal waking hours of the day. Frequent walking decreases your risk for developing blood clots. It also supports bowel function and helps your lungs recover after surgery. It decreases your pain and stiffness, and as you advance your walking, it will help with your healing and general recovery. Limit napping and resume a normal sleep-wake schedule as soon as possible. You will not need to wake up during the night to walk every 45 minutes, but you will likely be more stiff and achy in the morning due to that longer period of inactivity. If your medications are making you too sleepy or unsteady to walk safely and as much as recommended, decrease the use of these sedating medications until that sedation clears. Walk as much as you can tolerate without increasing your pain and other symptoms. Pushing yourself to advance your activities too quickly or suddenly is likely to flare up inflammation, irritate healing nerves, and make your recovery slower and more painful. Listen to what your body tells you to find a healthy balance of activity and rest for best healing. You should expect throat pain and swelling and some difficulty swallowing after your cervical spinal surgery. Before you discharge from the hospital, a speech-language pathologist may perform a swallowing evaluation to confirm you are able to swallow and instruct you on techniques to help you swallow safely while you heal from surgery. Though it may be difficult and painful to swallow, you should be able to breathe without difficulty and swallow without choking, to take in adequate fluids and soft foods, and to take your medications safely. If your swelling causes difficulty breathing, or you are unable to swallow your medications and fluids to stay hydrated, present to the emergency department for immediate evaluation and treatment. It is very important that you stay well hydrated, and cool or cold fluids may soothe your throat pain and decrease inflammation. You may also apply a cold pack to your throat for 15 minutes before eating or taking medications, and as needed to decrease inflammation and provide temporary relief of throat discomfort. Advance your diet slowly and as tolerated until you are able to resume your regular diet. You may need to add a liquid nutrient supplement such as Ensure or Boost to provide adequate nutrients for healing. Check with your pharmacist to discuss which of your medications may be cut or crushed for easier swallowing. You may also take medications in applesauce, yogurt, or pudding to help them slide down your throat more comfortably. It is normal to feel like there is a flap trapping things in your throat, which may make it difficult to swallow, clear your airway of mucus, and even belch. This should diminish progressively with time. As the inflammation diminishes, your incision heals and your scar softens. After surgery, you will be managing several types of symptoms, including surgical pain and constipation, as well as possibly muscle spasms and nerve pain. You will also need to do some things to help your lungs recover from surgery. The tiny air sacs that exchange gases in your lungs become sticky, and mucus accumulates, which can lead to pneumonia if it persists. While you are in the hospital, your nurse and respiratory therapist will encourage you to take frequent, slow, deep breaths and cough out any mucus that's accumulating in your airways. You may also be provided an incentive spirometer like the one shown in the image. Continue these measures when you're at home. Stay well hydrated with fluids such as water and herbal tea to help your lungs recover from surgery. Your frequent walking will help your lungs recover and will also help restore bowel function, decrease aching and stiffness, and help resolve muscle spasms and provide temporary relief of nerve pain. Some other soothing measures include soaking in a warm shower, applying heat or alternating heat and ice, gentle massage, and gentle leg stretches. Be sure to stay within your restrictions. These measures are particularly helpful for nerve pain because the medications are not usually very effective to relieve these symptoms. You will be prescribed medications to help with surgical pain, muscle spasms, and constipation. Bowel function is usually slower than normal after surgery and while you're taking narcotic pain medications. You will be prescribed a laxative called lactulose when you discharge from the hospital. If you are lactose intolerant, you will not tolerate this medication, and you'll want to discuss an alternative with your pharmacist. Laxatives and stool softeners should be taken routinely until your normal bowel function returns. In order for these medications to work, you will need to increase your intake of water and walk frequently. In addition to these medications, avoid constipating foods and eat whole fruits and vegetables. Prune juice, a fiber supplement, herbal laxative teas such as Smooth Boof by Traditional Medicinals are also helpful to keep bowels moving and are available at your grocery store. If these measures are not working, you may use a suppository or add magnesium citrate if you need to. Magnesium citrate is a clear liquid that is used to prep bowels for colonoscopies. It is usually very effective, but it's not a lot of fun, so you may want to try the other recommendations before stepping up to this measure. Sometimes the use of narcotic pain medications slows bowel function to a stop. If you are not passing gas and not having bowel movements, especially if you develop any nausea, vomiting, abdominal pain, and bloating, you will need to present to the emergency department for evaluation and treatment. Some other symptoms that require immediate evaluation in the emergency room include any difficulty breathing or chest pain, severe uncontrolled pain, inability to walk, loss of feeling or strength in your arms or legs, a sudden loss of bowel or bladder control, or any trauma, such as a fall, especially if you hit your head or lose consciousness. After surgery, you are at increased risk for developing blood clots. Most blood clots occur with no symptoms, so if you notice any symptoms, these need to be evaluated. Besides the difficulty breathing and chest pain already mentioned, monitor your legs for differences in one leg compared with the other, including swelling, discoloration, changes in temperature, pain, or a palpable lump. The urgent care clinic may be able to evaluate your legs to determine if you have a blood clot. So if you don't have chest pain or difficulty breathing, you should go to urgent care instead of the emergency department if they're open. If it is after hours, do not wait. Go to the emergency department. The goal of postoperative medications is to use the minimum medication necessary to consistently manage your symptoms to a tolerable level. The narcotic pain medication and muscle relaxant prescribed after surgery are a high-risk combination of medications and should be taken carefully to minimize risks. It is important to understand what symptoms each of these medications treat. For surgical site pain and incision tenderness, as well as any chronic pain issues you may have that are not from the surgery, you may use your narcotic pain medication. Acetaminophen, or Tylenol, is the only over-the-counter pain medication that is recommended for at least 12 weeks after a spinal fusion. It may be used in place of your narcotic pain medication, but check with your provider before using it with your narcotic, because some narcotic pain medications contain acetaminophen, and exceeding the maximum recommended daily intake from all sources may cause liver damage. NSAIDs such as ibuprofen, naproxen, meloxicam, Advil, Motrin, Aleve slow healing and may interfere with your fusion. So remember not to take these until your surgeon clears you to resume their use at least 12 weeks after surgery. Use your muscle relaxant medication to relieve intolerable, prolonged muscle spasms and intolerable muscle tightness that impairs your ability to sleep or rest. As your symptoms change with time and healing, adjust the use of your medications. You will notice that there are times when you need a stronger dose and other times that you may not need the medication, or that you can manage the symptoms with acetaminophen and soothing measures. It is expected that you will taper to at or below your preoperative use of medications by 6 to 12 weeks after surgery, and many patients may wean their use of medications much more quickly, especially if you are not taking pain medications prior to surgery. If you need some help managing your medication or with strategies for weaning the use of your medications, a nurse in the neurosurgery clinic will be happy to discuss this with you. You will also have a prescription for naloxone nasal spray. This is a rescue medication that reverses the effect of opioid pain medications if you experience adverse effects of these medications. These adverse effects might be becoming overly sedated, unresponsive, or experiencing respiratory depression. That would be recognized if you are having less than 8 breaths per minute. Your pharmacist can provide additional information and instruction to caregivers on the proper use of this medication. As noted in the Preparing for Neck Surgery booklet on page 34, nerve pain is commonly experienced after spinal surgery and requires special consideration because the narcotic pain medications and muscle relaxants are not usually effective to treat this type of pain. They may actually make it worse and cause the nerve dysfunction to last longer. These symptoms slowly and progressively improve with time and healing as inflammation from the surgery diminishes and your nerves heal. The recommended soothing measures such as warm showers, application of heat or alternating heat and ice, gentle massage, gentle leg stretches, and frequent walking may provide temporary relief of the symptoms. You should continue frequent walking, but otherwise limit your activities to avoid further flaring the nerve irritation. Steroids and anti-inflammatory medications slow healing and put fusions at risk, so they are avoided. Do not take NSAIDs for at least 90 days after surgery unless and until your surgeon advises otherwise. Nerve pain medications such as gabapentin can take up to 4 to 6 weeks to build to therapeutic levels if you're not already taking these. But they may be prescribed if your symptoms are intolerable and persistent. The neurosurgery providers will manage your pain medications for up to 12 weeks after surgery. If you are taking narcotic pain medications prior to surgery, you may need more time to taper the use of your medications. Discuss pain management with your primary care provider prior to surgery and make a plan for pain management in the event that it is needed beyond 84 days after surgery. The prescriptions you are provided upon discharge will include a quantity to ensure that you do not run out of pain medication, especially if you do not live locally to Walla Walla. If you do not expect to need the quantity that is ordered, you may request that the pharmacist partially fill the prescription. Request refills for non-narcotic medications, such as your laxative and muscle relaxant, from your pharmacy. For refills on your narcotic pain medication, call the neurosurgery clinic or send a request through MyChart. Allow at least 2 business days to process your refill request before you run out of medication. Pain medications require a paper prescription for each refill. You may pick it up at the clinic, or we can send it U.S. certified mail, and a signature will be required. We are not able to send, fax, or call these orders to your pharmacy. If we are mailing your prescription, Be sure to allow mail time in addition to the 2 business days to process your request. When you request a refill on your pain medication, we will need the following information: the name of the medication, how many tablets you have left, how many tablets you are taking at a time and how often. Update us on your pain and how it has changed. Let us know if the prescription will be picked up in the clinic or if you want us to mail it to you. If someone other than you is coming to pick up the prescription in the clinic, we will need to know who is authorized by you to pick it up before they arrive. They must be at least 18 years old and bring a valid state-issued photo ID. If we are mailing the prescription to you, please verify your mailing address and someone will need to sign for the delivery. We will call you to let you know when the prescription is ready to be picked up or when we are sending it out in the mail. For the first 5 days after surgery, you will need to change the outer dressings that cover your incisions frequently to keep them clean and dry. Have someone check your wounds daily and monitor how they are healing and changing. It is expected to have diminishing redness, swelling, and bruising. You should have little to no drainage, and the edges of your incisions should heal nicely together. You will be provided with plastic covers to use for showers for these first 5 days. On day 5, you may remove the outer dressings and leave them off. These are either brown Band-Aids or clear Tegaderm adhesive dressings. There may be white tape across your incisions. These are called steri-strips, and they reinforce the edges of your incisions while they heal. The steri-strips can get wet. Just pat them dry. If they fall off on their own, you do not need to replace them, and any steri-strips that are still in place at 2 weeks after surgery may be removed. If you notice any increased redness, swelling, heat, pain, increased drainage, or edges of your incision coming apart, call the neurosurgery clinic and we will schedule you the same day for a wound check with a registered nurse. You may also have a wound check at the urgent care clinic if it is after hours or on the weekend. If you live out of town, your primary care provider or local walk-in clinic will be able to check your wound. If the adhesive dressing causes skin irritation in the tissue surrounding your incision, remove the adhesive dressing and cleanse the traces of adhesive from your skin. Apply a cold pack to calm the irritation, and you may take Benadryl as directed. Have a wound check if the skin irritation does not resolve with these measures. Frequent walking is the only recommended activity immediately after surgery and until you are cleared to advance your activities by the physician assistant or surgeon. For the first month after surgery, you will need to avoid bending, twisting, and turning your spine. You will also need to avoid lifting and will be limited to a maximum weight of 5 pounds that may be lifted between shoulder and waist height if necessary for activities of daily living. Plan ahead to place items that you regularly need at a height you will be able to access within these restrictions, and arrange for assistance with anything that requires restricted movements and activities. Wear your brace as much as recommended, and you may use it more for support and comfort as needed. It is important to limit your activities to avoid flaring your pain and other symptoms, rather than pushing your activities and taking more medication to tolerate the pain. You will achieve better outcomes if you follow this recommendation and allow yourself the time to heal well. Most surgical incisions are closed with multiple layers of absorbable sutures and skin glue, reinforced with steri-strips, and covered by adhesive outer dressings. Some will have surgical staples or sutures that need to be removed at 2 weeks after surgery. If you have these, you will be scheduled for a wound check in the neurosurgery clinic for the removal of these materials. If you do not have surgical staples or sutures that need to be removed, your first appointment will be at about 4 weeks after surgery. You will have x-rays completed at the hospital at least 45 minutes before your check-in for your appointment. This will allow time for the results to be ready to review at your appointment. The physician assistant will review your imaging and discuss how you may safely advance your activities and wean the use of your brace, depending on how you are healing. At 12 weeks after surgery, you will have another set of x-rays at least 45 minutes prior to your appointment, and you will meet with your surgeon to review your imaging and the progress of your healing. Your surgeon will advise you of the intervals for additional imaging and follow-ups that are usually by telephone to review your results. Additional appointments may be scheduled as needed if there are any concerns about the progress of your healing or if you're experiencing any worsening or new symptoms. In the case of an illness or unsafe traveling conditions, please call the clinic to reschedule your appointment. We don't want you to risk your life or limb to make it to the clinic, especially if you live out of town. The following few slides cover some frequently asked questions from previous patients. You may send someone to pick up your paper prescriptions during our clinic hours. They must be at least 18 years old and bring a valid state-issued photo ID, and you must let us know before they arrive that they are authorized to pick this up. Prescriptions are not available to pick up after clinic hours, on the weekends, or on holidays that the clinic is closed. For holiday weekends, you will want to allow additional time for refilling your prescriptions. To resume driving, you must not be taking any pain medication or muscle relaxants, and the physician assistant or surgeon must clear you to advance your range of motion enough to check traffic, blind spots, and for pedestrians. You also need to have the reaction times necessary to suddenly accelerate, decelerate, or change directions. Remember to wear your brace while you're in a vehicle, as this activity involves increased risk, whether you are a passenger or the driver. There are many different things to consider when planning your return to work. The timing and conditions for your return will depend on the surgery you have, how you are healing, the work that you do, and the accommodations your work and your employer are able to make to help you return to work safely. Be sure to discuss this with your supervisor and ask about options for flexible schedules, lighter duties, shorter shifts, work from home, and other options your employer may offer as you slowly increase your ability to tolerate activities as you heal. Formal physical therapy is not always needed after surgery. If there are specific concerns or if you feel you would benefit from physical therapy, this will be discussed at your 4-week post-op appointment or later. If it is ordered, physical therapy usually starts in a pool. Otherwise, and more commonly, your walking is your physical therapy. Walk frequently and advance the distance you are able to walk progressively and as tolerated. For disability or return to work forms that are needed, complete any portions of the form that do not require the provider's recommendations. Note any specific wording that is needed and provide the form with any supporting documents, such as a job description, to the clinic well in advance of the deadline. If you or your family are traveling to Walla Walla for surgery or for your appointments and need to stay overnight, we have a list of local hotels that offer discounts to our patients, and we are happy to provide this to you upon request. Management of pain medications requires some advanced planning. The neurosurgery providers only manage medications for up to 12 weeks after surgery. If you are taking pain medications prior to surgery, you may need pain medications longer than this time. Make an appointment before surgery to discuss pain management with your primary care provider and make a plan. If your primary care provider is not willing to manage pain medications, a referral to a pain clinic or a pain specialist may be needed. It can take several weeks to process these referrals and to get scheduled, so it is important to start this early so you have this resource in place if you need it. If you would like to discuss anything further or have other questions, please contact the Neurosurgery Clinic by calling 509-897-8300 during our clinic hours, or you can send us a MyChart message at any time. The Neurosurgery Clinical staff checks MyChart messages first thing in the morning and throughout the clinic day. We are also available to assist you in the activation of your MyChart account and to walk you through how to use this resource if you are not familiar with it.